Okay. Good morning, Mrs. Fumi. Thank you so much for coming on the Cheese Pod. So I am Chika of Cheese Pod, and this is Mrs. Fumi of Able Gods Medicals. So Mrs. Fumi, introduce yourself to the audience
Okay.
before we delve into the topic of today.
All right. Good morning, good afternoon, good evening, wherever you are watching us from.
Okay.
My name is Mrs. Odiano Sefumilayo. I'm a registered nurse and also a fertility coach. I'm happy to have you here.
Okay, thank you so much for coming on the Cheese Pod. So Mrs. Fumi, it has been really insightful having you all this while. I promised them the last time that you'll be on today's episode, that they should watch out for you, that you pour more light on the last topic we had on the cheese pod. So today we will be starting with um, how does blood type affect infertility?
Okay.
Yeah.
Thank you very much. It's
Yeah.
a very good question.
Okay.
Majority of people don't even know about this, and thank you that I'll be talking more about this. The first thing is you should know your blood group. There are
Yeah.
4 types of blood group.
Okay.
We have A, B, and O. The most affected blood group concerning infertility is O.
Hmm.
Yes, any woman with O blood group, either positive or negative, has been shown to have high risk of infertility.
Wow.
Don't quote me wrong. You might be O and you have been having children, but it is higher in them. You might be lucky, maybe because you are married early. Because it has been shown that their O antigen or the blood group does not have protein. And you know what protein does? Protein is a very good nutrient. It replenish worn out cells. So even to the ovarian cells. Yes. So in a case whereby you are either positive or negative, the risk of infertility is high, because it has been also shown that you can go into low ovarian reserve very faster, because there is no protein on your antigen to help you continually replenishing the ovarian cell.
Okay.
Compared to A group blood group.
Okay.
Yes, that A has a very nourishing protein on the yes, and then AB followed, then B. So but the one we want to do more is O. So if you are O, either positive or negative blood group, you should watch out. They tend to go into their menopause very early.
Wow.
Yes, because they tend to have what we call low egg count, low ovarian reserve. They are being graded like that. It's nobody's fault. Then secondly, the follicle stimulating hormone tends to work in excess to actually make sure that an egg is being produced.
Wow.
Yes. So most times when they go for their what we call hormonal profile test, their follicle stimulating hormone are always high. Yes. So if you are O blood group, I want you to sit back, watch this video, and I want you to go, and if you don't know your blood group, please go and check it. If you put women, let's say 5 women with a blood group, we have at least 2 of them that are presently facing fertility issues.
Wow.
Yes.
With the O blood
with
group.
the O blood group. Yes.
Wow.
Compared to other blood groups.
Wow. So research has been made and has shown that the O blood group type women tend to suffer infertility earlier in life, and they don't have the cells that helps them boost and reproduce eggs faster, unlike the other A, B, and B blood types. So as an O positive or negative person, you need to boost your cells by taking or consuming more proteinous food.
Yes.
It helps you, and some medications like that. So does it mean that most of the women that have irregular menstruation, it could be as a result of their blood types too?
It's very possible.
And they
Very
could be
possible.
old, like some women that really have this O blood type
Yes.
may suffer from irregular
Yes, it's
menstruation.
very, very possible.
Wow.
Because their ovarian reserve diminishes faster. Yes,
It diminishes
it's very
faster.
faster. Yes,
So
so anything can come up.
wow, wow. So this is so insightful. I didn't even know we had four blood group type. So having Nosfumi on the cheese pod is very, very important because it educates us on a lot of our day-to-day life, our health, and other things that we need to know. Okay, so moving on, let's go to the second question on our list. So, Nosfumi, what treatment do you recommend for the blood types, for these blood types, the one that has a blood, low reproductive cells, and the one that have high reproductive cells? What treatment recommendations do you have for them?
Okay, generally,
Mm.
with age, every blood group diminish in their cells production.
Okay.
Yes, so we are encouraged to go off CoQ10. Yes, very, very good.
CoQ10.
Yes, but for people with O, it's the moment you detect your blood group early enough, please don't joke with your ovarian reserve. Get something that contain antioxidants. Drugs like myo-inositol, drugs like CoQ10, drugs like melatonin, drugs like magnesium glycerate, drugs, some supplement that has iodine inside. They will help you to actually protect your ovarian reserve. Not that you will not diminish, but even when you are diminishing, you will still be able to produce a good egg. The egg that is quality, because most time what we need to achieve a pregnancy is a quality egg.
Wow.
Not numerous eggs.
Wow.
A quality egg that at least when your man meets with you, you can easily achieve. If it's just one fetus is good, but at least when you produce a very good egg, pregnancy
Can be achieved. Wow.
So you continue with that. Then if you have a girl child that you know is O positive from their moment
Early stage.
when they enter menarche, help them to start protecting their egg quality.
Wow.
Yes,
Wow.
very important.
Wow.
So we advocate for egg quality, not egg quantity, but egg quality.
Wow.
Egg quality.
Wow, thank you so much, Nosumi. This is really, really insightful. I hope you grabbed the treatment recommendations she recommended. CoQ10, right?
CoQ10,
CoQ10,
myo-inositol,
NAC,
magnesium glycerate, vitamin A.
Yeah.
In fact, vitamin A has been shown to do a greater job on your egg egg quality, vitamin E, and so on. You can
and so
actually
on and so
consult
forth.
for more.
Okay, if you need like special recommendation, because recommendations on here is just vast. It's just something that we can put out there that anybody can pick it up. But if you want a tailored medication for your own type of situation or whatever you're going through, you know that you need to consult a registered trained professional like Nosfumi here. You go to her DM and she will tailor your own treatment recommendation. Do you understand me? So don't hesitate to contact her. You go to her for consultation and she will tailor your own treatment recommendation. Thank you so much. So uh, let's move on to the third question on our list this morning. So, treatment options for couples that are struggling with infertility. What treatment options do you recommend for them?
We have a lot. We have a lot of treatment options based or depend on the cause of your infertility.
Okay.
But before I further talk about that, I will explain. Infertility has been said is inability for couples to achieve pregnancy.
Yeah.
If you are less than 35 years, if you have been struggling to achieve pregnancy in in a year, it's called infertility. But if you are above 35 years, we believe in 6 months, should be able to, if it's difficult to achieve pregnancy, that is infertility. Then what should you do? The first thing is to get to your fertility experts and run what we call fertility tests. And this is done for both the husband and the wife, not only wife, because I see a lot of situations that men pushes their wife to go and I'm okay. No, for the emotional support, let both, even if you run your test and you are okay, still support your wife.
Wow.
That is number one. Secondly, when they place you based on the result of your test, they will place you on some treatment modalities and options. Anything they are giving to you, if it's not working out within 6 months, I'm very sure a fertility expert will recommend what we call IVF or IUI.
Wow.
So in that process, IVF is not a bad thing. It's just for you to achieve pregnancy.
Yeah.
And like what I always tell people, you see, there are a lot of things that can deprive you from achieving pregnancy as a woman. So that your investigation must be comprehensive.
Okay.
In fact, to the extent of hysteroscopy.
Wow.
Because hysteroscopy is just the only means that can actually give us the total figure of your uterus.
Wow.
The shape, if there is a scar in the uterus, you can't achieve pregnancy.
Wow.
So with hysteroscopy, they can remove the scar because it's a visualized equipment or instrument that actually sees. It has a camera. Yes, it has a camera.
Okay,
to
just
see.
like endoscopy.
Endoscopy, good. It has a camera to see everything, which scan cannot even determine.
Well, so that's a more advanced
yes,
check.
Yes. Yes, so it's always good. Even if you have not done any surgical procedure, you have not done abortion, because it could be congenital abnormalities or unknowingly to you that come with some scars.
Some things are congenital.
Yes.
You know what for the layman watching, Mrs. Fumi, what is congenital?
These are cases that you were born with, from your mother's womb. You come out with it.
Yes.
So, and you'll be struggling to achieve pregnancy, not knowing that you're having issue. Why am I saying this? I had some cases recently. She has not done abortion before, not surgical procedure, but they did hysteroscopy on her and they detected some scars and some growth that scan. She has done scan severally, but scan has never been able
to detect that.
Until she went in for, and during that procedure, they were able to remove those things. And there is something they place in her for that scar tissue not to form again. The thing will be there for at least for some weeks. So that when they remove it, it will have healed up, then scar will not form again. Then pregnancy can occur.
Thanks to God, but thanks to technology for has been able to advance and evolved. Imagine that technology has not advanced to this level of hysteroscopy, and this woman would have been suffering from a congenital issue. So we thank God for all these things, all these feats that we've been able to achieve with technology today. Thank you so much, Nosfumi, for that lovely insight. So let's move on to the last question of this episode. How do you help them manage stress and stigma? Like couples that have been struggling with infertility, how do you help them cope with stress management, stigma, and loss of hope and all that?
Well, if I may say, infertility is actually stressful. It's energy consuming, it's financial consuming, everything. But personally, I think to help people cope with stress is individualized. What I do on my own and with my team, what we do is, being a child of God and a Christian, we inculcate prayers, word of God. Not everybody that wants to hear you,
of course,
yes, but please,
not every client
that want to. If what you do is first of all observe your client, understand the background, understand who the client is. It will help you to know how to manage such clients.
Exactly.
So in the case of I have a client that doesn't really like to know, when you send them a message, instead of to tell you amen, they say sure. You know they don't want any word of prayer.
Exactly.
So what you do is you follow up with their medications. At least you make sure that even we are not the one that prescribe it, still follow up, make sure that they are taking it. In some of them, we help them to calculate their fertile period. Their husband will tell us, oh yeah, be helping us. While you are talking to the wife, in some cases you talk to the husband. You let them know that this condition is not a permanent condition.
Exactly.
Yeah, that it will still change with time. I've seen some clients that we have been on treatment for a year, 2 years, and they achieve pregnancy.
Yeah.
It's just for you to be patient.
Yes.
The most important aspect of this issue is patience. If you're able to be patient, you achieve pregnancy.
Okay.
Yeah, so that's what we do most times. We always encourage, we counsel them often because it's not easy.
Yeah, and follow them up with their medications.
Yes, follow up.
Okay, thank you so much, Nosfumi. Really happy to have you on this episode, and we won't or we can't wait to have you on the next episode. So see you on the next episode of Cheesepod. But for now, bye and take care. Enjoy the rest of the video. Bye.
Bye.
Yeah.